Hello, I'm Dr. Jia Ruan from Weill Cornell Medicine. Welcome to today's online journal club. I'll be discussing a multi-center phase 2 study evaluating the combination of lenalidomide plus rituximab as initial therapy for mantle cell lymphoma. The paper was recently published at the New England Journal of Medicine. As you know, mantle cell lymphoma is a distinct subtype of non-Hodgkin's lymphoma and primarily affecting more elderly population and can be aggressive. The initial therapy for mantle cell lymphoma is not standardized. Conventional chemotherapy are generally not curative and may not be well tolerated by all patients. So we, together with our co-investigators, hypothesized that a biological combination would be well tolerated and active as initial therapy for mantle cell lymphoma. So this phase 2 study has a couple of unique features. First, it is not chemotherapy based and utilizes a combination of biological compounds, in particular rituximab, a anti-CD20 B-cell specific monoclonal antibody, and lenalidomide, which is an oral compound that targets both lymphoma cells as well as their microenvironment. Second, this particular study is an outpatient-based continuous treatment regimen that included both an induction and maintenance phase. Patients started with lenalidomide 3 weeks on, 1 week off, plus rituximab infusion weekly times 4 for the first month, and then every 2 months. At the end of the 12th treatment cycle, the patients who are responding to the therapy would move on to the maintenance phase, where they would continue lenalidomide but at a reduced dose, and as well as with ongoing maintenance rituximab. The endpoints for the study is to evaluate how effective this combination would be and what are the side effects associated with the treatment. The study outcomes are as following. A total of 38 patients participated in the study from 4 major academic centers, including UPenn, Moffitt, and University of Chicago, as well as Cornell. The patients would have typical mantle cell lymphoma clinical features, including median age of 65, and a third of them, in fact, had high-risk disease. All of the patients would require treatment. The overall response rate was over 90% for all patients who could be evaluated, and complete remission was at 64%. The 2-year estimated progression-free survival was 85%, with 2-year overall survival estimated at 97%. The majority of the patients maintained or improved their quality of life with treatment response. The treatment-related side effects most commonly would include cytopenias, which are generally manageable and reversible with medication dose adjustment, as well as lenalidomide-associated inflammatory symptoms such as fever, rash, or tumor flare, commonly encountered during the initial cycle of treatment and resolved with supportive care. So in conclusion, this biological combination with rituximab plus lenalidomide appears to have high activity as initial therapy for patients with mantle cell lymphoma. The combination also appears to be feasible and can be safely administered for both induction treatment and maintenance therapy. The phase 2 study provided a novel treatment framework as option for treatment-naive patients and should be studied further in a larger scale. I'm privileged to lead this phase 2 study with the support of my colleagues at Cornell as well as other co-investigators at academic centers. I'd like to also use this opportunity to thank all our patients who supported both our study and also lymphoma research in general. Thank you.